two arguments. Logical pricing and cutting bureaucracy were the biggest two single things. There are many, but these are the two best, most important ones. Logical pricing, we negotiate fair prices. Any single payer plan would have to do that. And we have negotiation of prices now, where you have multiple insurers and multiple groups of patients from employers and everyone with different risk adjustments, different age groups, everything else. And they're negotiating with thousands of different providers, some of which they can just dictate the prices to, some of which they have to fight and try and get the best they can. And actually, some of those negotiators have it in their interest to not negotiate the best prices, but have the best working agreements with people, which is strange to people. And Elizabeth Rosenthal, who was a New York Times reporter, medical doctor, who's now head of Kaiser Health News, she wrote a very thick book, which I summarize as saying everything you think you knew about economics gets screwed up in healthcare, and you assume the insurance companies have an incentive to fight to bring down prices, but in some cases maybe the opposite is true. And she tells plenty of stories that shows why that doesn't work that way. And so they don't always negotiate fair prices, but we need to. EpiPens went up sixfold in a decade. In 2013 or 14, I think it was, there were 60 prescription drugs in 1 year that doubled in cost, 20 of them quadrupled in cost. These are not, the fact that they were around at the beginning of the year and the end of the year suggests that they are not new drugs. They were at least on the market, and they doubled the cost, or quadrupled the cost. Other countries negotiate drug prices, so we obviously are the one that pays far more than anyone else. Medicare Part D, when that was passed into law, they explicitly prohibited the federal government themselves from negotiating prices. So in effect, they said to the pharmaceutical industry, we're going to buy as many drugs as our seniors need. Tell us how much we should pay you, which is a pretty dumb way to negotiate. It's not negotiating. Logical pricing, price disparities, knee replacements. A Yale study in 2015 showed a 16-to-1 price disparity for a simple knee replacement. Minnesota Health Department put out a similar study, did several types of things. They actually used the knee replacement too, I guess because it's a common one that's priced. And in Minnesota, the range was narrower, obviously, it's one state. It was like 4,600 to about 40,000 or so. It was only an 8-to-1 disparity in Minnesota. So much smaller range, but you try and find, you go to a Toyota dealer in White Bear, and you go to a Toyota dealer in South St. Paul, and you're not going to find 8-to-1 or 16-to-1 price differential. You're not. It's 5% difference, maybe. But you're not going to find 16-to-1 price disparity, 1,600 to 1. 1600%. Cutting bureaucracy, the other way you save money. By the way, with the price disparities, yeah, when you negotiate prices, you're probably not going to get all the knee replacements at the bottom end price. You're probably, when you negotiate them the way things work out, you might be paying more like $8,000 or $10,000 for them, maybe $12,000, but you're not going to be paying $40,000 or $50,000 for a knee replacement. You're going to negotiate prices, and you're going to cut out so many other players in the system that you don't have to, that it costs them less to do it. The cheapest hospitals would probably be able to, instead of $3,500, they'd be able to do it for $2,000, because you cut out so many of their expenses. The other way is the bureaucracy, where we are cutting out the expenses. And the analogy I've been using in the last year or two to explain this is, because I think we need to, analogies work, and this one is a logical one. What if we funded our schools like hospitals, excuse the funny clip art, but I tried something, I'm not good at the clip art stuff. If schools were funded like hospitals, education would change. Teachers would spend time to allocate the resources they spend for each student. That takes a significant amount of time. And then they'd send that to the school's billing office. They would allocate all the overhead, the capital, the administrative, the maintenance, everything else like that, utilities. Parents would purchase school insurance plans, because school is very expensive. If you think of how much we're spending per kid for education, you can see why. And if your kid's special needs kid, it might be 5 times as much or 10 times as much. So you can't handle that, so you buy school insurance. Employers would offer school coverage because those plans are very expensive, and unfortunately not every parent is going to be working for a company that offers school benefits. So we have a exchange perhaps where you buy in the individual market, and not everybody could afford that, so we subsidize that, and it begins to sound like something we already know. Bills would be sent to each parent's school insurance plans at an inflated price because they have to negotiate, because every school insurance plan is going to negotiate in different ways, so they start high and they negotiate lower. Of course, those that don't have the insurance plans are going to have to pay the full price, which is a pretty raw deal. And of course, people can't afford school insurance, can't afford to pay the higher prices, so they go into debt, sometimes bankruptcy, and the schools would have to shift costs around and bill other parents higher because other kids weren't covered. You get a huge confused mess. Many of the families, even those with in-school insurance, struggle to pay co-pays and deductibles, so you need to have a collections agency for the schools as well. Is this going to improve education? I think you know the answer to that one. It takes resources from teaching to that. Think how many school administrators and teachers would be wasting time on paperwork and billing instead of educating. And even the parents, filling all the time, choosing school insurance plans, figuring out this, sending in the co-pays and deductibles, and time they might be able to spend with their children, helping them grow and helping them learn. Students might be forced to switch schools if their school's out of network, or teachers are out of network, you don't have coverage, forget it, you don't get an education unless somebody steps in. Would it save money? Of course not. Much more expensive system. And if you figure these insurance companies, and since you don't have any to imagine, just imagine the health companies decide they're going to branch out and cover it to Group Plus for education. Health Partners could form an education partners, UCare, whatever you learn. Medica, Educa maybe, and maybe for Minnesota Care, a public option, we could have a Minnesota Learn. And it might provide better coverage than the other plans and so on, but ask yourself, why do we want insurance plans for education? Why do we want to have all the people work at Blue Cross and education partners and Minnesota Learn? Why do we want to pay all their salaries and all their administrative costs to bill everybody for all this stuff? Be a huge increase in expense. This is a chart that Physicians for National Health Program put together a number of years ago. The small sliver at the bottom is the growth in physicians from 1970 to 2009. And in contrast, the growth of health administrators, you can see there's a gap there. We're getting the system much more complex and so on. You can see why that cost goes up so much.